Good morning. Thank you. I appreciate the response. We have the second line welcoming folks in today for the first day of the annual legislative conference, so I'm glad that we're continuing that energy. As I said, my name is Dr. Jonathan Cox. I am the Vice President for the Center for Policy Analysis and Research at the Congressional Black Caucus Foundation, and it is my honor to welcome you all to the 53rd Annual Legislative Conference of the CBCF. That's exciting, right? It is. Now, each September, this gathering provides a vital space for us to address the challenges and opportunities affecting Black Americans and the global Black community. Now, as the largest public policy conference dedicated to issues that are important for Black communities, ALC is a center for innovation, strategic thought, and tangible action. Now, this year's theme, From Vision to Victory, Amplifying Black Voices, is both timely and essential. Now, amplifying Black voices remains a priority for creating change. Black voices remains, it's not only just for Black people, but for society as a whole. Right? And history has shown us that when Black Americans rise, the entire nation thrives. Now, whether that's through economic progress, civil rights advancements, or even upholding the promises of democracy itself. Now, as we close out a key election year, the urgency to turn vision into victory by raising our collective voices cannot be overstated. Now, at the Center for Policy Analysis and Research, we are proud to be a part of the CBCF's mission to inform policy and educate the public. Now, through data-driven research and analysis, as well as timely and relevant policy recommendations, we seek to have a lasting impact on issues that matter to Black communities. Now, this session is a manifestation of that mission. Today, we will hear from leading voices of innovators who are pushing for change at every level of policy and practice. And we deeply appreciate their time and their efforts, both today and in their ongoing work for the betterment of our community. I also wanted to take this opportunity to thank our session sponsors, AHIP, Advocates for Community Health, the Association of Clinicians for the Underserved, and United Way Worldwide. Aside from their gracious sponsorship of this important discussion, I thank them both for their commitment to issues of equity and equality. For it is only through such conscious action that we can begin to reduce and eliminate disparities in health for Black people. And now, it is my pleasure to introduce to you one of our sponsors from United Way Worldwide, Dr. Nicole Cooper. Dr. Cooper serves as Chief Strategy and Innovation Officer and Executive Vice President at United Way Worldwide, guiding global, domestic, and state public policy and advocacy efforts, public-private strategic partnerships, social innovation investments, and the 211 helpline network throughout the U.S. to help reimagine and rebuild systems that address inequities and better serve communities. Dr. Cooper holds a bachelor's degree from Spelman College, a master of public health degree from health management and policy from the University of Michigan, and a doctor of public health in health policy from Harvard University. So please join me in welcoming to the stage Dr. Nicole Cooper.
Gracious introduction. So I want to thank the entire Congressional Black Caucus Foundation team for ensuring that yet again we have an amazing annual legislative conference. It has certainly kicked off with a boom, so I'm excited to be here. And I want to thank you all as well for allowing United Way Worldwide to co-sponsor this important session today. So as was stated, I'm Dr. Nicole Cooper. I proudly serve as the Chief Strategy and Innovation Officer for United Way Worldwide. I help lead our national public policy team, and as was stated, the team that supports the 211 helpline that is accessed by 20 million people each year in this country because they need help, much needed help, with social services and health services of all kinds. United Way works locally each day to bring people together to build strong, equitable communities where everyone can thrive. Each day, we help communities tackle tough challenges, and we work closely with public, private, and nonprofit partners like all of you all in the audience today to get the work done, to ensure that we improve outcomes in our core areas of advancing health equity, and improving youth opportunity, and improving economic mobility, and improving community resilience. As one of the largest nonprofits globally, we actually have about 1,000 local affiliates that are spread just across the U.S. We estimate that we help make life better every day for 48 million people. We are excited to sponsor this really important session today that's focused on the extreme maternal health crisis that our country faces. Well, I want to share with you all that I'm a lifelong public health practitioner. I'm also a mother, a Black mom to 2 small children, and a wife to a committed Black father and husband. And so this is personal to me and professional. And I'm deeply, deeply concerned that across the board, Black women and Black birthing people have worse maternal health outcomes than our white counterparts. It's unacceptable. From preterm births to lack of access to equitable care, to insufficient prenatal care, and poor postpartum recovery supports and services, the U.S. health system is failing Black women and their families during a time that should be full of joy and hope. United Way Worldwide is committed to fostering equity in all of its forms, and that is why this issue is so important to us, and that's why we're here today. Our focus on improving health equity and improving maternal health outcomes for Black women in particular is a cornerstone of our mission, and we very much so support empowering Black fathers to be allies for Black maternal health as a common sense solution to turning the tide on this societal failure. And we hope that the Momnibus Act soon becomes law, as this bill directs federal agencies to do 13 things, but in particular, I want to call out that once it becomes law, will diversify the maternal health workforce. It will help to test new payment models for perinatal care for Medicaid covered moms in our country, and also under the Children's Health Insurance Program, otherwise known as CHIP. And third, it will expand much needed postpartum and breastfeeding programs under the Special Supplemental Nutrition Program for women, infants, and children, otherwise known as the WIC program. So today, we aim to raise awareness, learn from each other, and inspire change to improve Black maternal health. So thank you to the partners, the panelists, and the amazing speakers for joining us in this discussion today, and thank you again.
Now coming to the stage, Jumi Obayanju, Senior Director, National Racial Equity Initiative for Social Justice at the Congressional Black Caucus Foundation.
Good morning. It is my pleasure to introduce our moderator for this morning to kick off our conversation. Coach Jessie Thompson, fibroid survivor turned health activist, is the founder of the DetoxNow.com, a holistic health provider of education and supplements that help combat the nutrition and health disparities that lead to obesity, chronic disease, reproductive health issues, and lower life expectancy rates. Coach Thompson educates and empowers BIPOC women on how to achieve optimal health through what she calls detox living. Life free of toxic thoughts, habits, people, and definitely foods. Her balanced system has helped over 200 women relive their symptoms and reclaim their lives from fibroids and more, including having successful pregnancies, miracle babies after years of infertility caused by those issues. Please help me welcome to the stage Coach Jessie Thompson.
Good morning, everyone. Can you hear me? Is my mic on? Yes, it is. Good morning, everyone. Good morning. So I am personally excited about this conversation, and we're going to jump right in by inviting our panelists to join us. So join me in welcoming Dr. Charles Daniels. He is a licensed independent clinical social worker with years of leadership experience. He is the founder, chief executive officer of Fathers Uplift, the nation's first mental health and substance abuse treatment facility for fathers and families, helping fathers become and remain emotionally stable for their children. He is also a visiting research scientist at Yale University. Dr. Daniels has spent the last decade providing therapy to Black men, helping them overcome the effects of toxic masculinity, racism, and oppression. Please welcome Dr. Charles Daniels. Next, we would like Dr. Sheehan Fisher to join us. He is an associate professor and perinatal clinical psychologist at Northwestern University. Northwestern University's Feinberg School of Medicine and the Associate Dean for Diversity and Inclusion at the Graduate School. His research focuses on parental mental health, involving both mothers and fathers to understand their distinct impact on child health outcomes. A recognized leader in diversity, equity, and inclusion, Dr. Fisher advocates for more inclusive practices in perinatal research and policy, particularly for marginalized communities. Welcome, Dr. Fisher. Next up, I already mentioned the boss of bosses here, Dr. LaShawn McKeever is a proven public health leader with over 20 years of experience driving health equity initiatives and public policy reforms. In 2023, she became the inaugural Senior Vice President and Chief Health Equity Officer at AHIP, where she leads strategic strategies to promote equity across the healthcare industry. Previously, she served as Director of the Center for Medicare and Medicaid Services Office of Minority Health, spearheading efforts to address health disparities and improve care for underserved populations. Before this, she served as the Department of Health and Human Services Commissioner on the U.S. Commission for the Social Status of Black Men and Boys and on the White House Interagency Policy Council's focus on maternal health and social determinants of health. Welcome, Dr. McKeever. Next up is my dear friend, I'm going to call you Doctor here, Charles. Charles Johnson has dedicated his life to the pursuit of what his own family failed to receive: safe, respectful, and equitable maternal health outcomes in America. After the tragic loss of his wife, Kira, we speak your name, following the birth of their second child after a routine C-section in 2016, Charles turned his grief into a mission by founding 4Kira4Moms, a nonprofit organization dedicated to advocate for systemic change in maternal health care. His work focuses on addressing the rising maternal mortality rates, particularly among Black women, and ensuring childbirth is safe and respectful for all mothers. Welcome, Charles. So thank you, everyone. Again, before this started, we were talking about the fact that we do not have the option to not be the cavalry. We have to be our own cavalry. But you know what? We are working so that it won't be that for future generations. So we're going to jump right in. As we kick off this conversation, I want to acknowledge that Black women's maternal health is deeply personal for each of you, right? Let's start by having each of you please share briefly about your personal journey that led you to become advocates for this cause. We'll start with you, Dr. Daniels.
Thank you for having me here today, and for me it's personal. During the birth of my son, Clayton Charles Daniels, the apple of my eye, while in the hospital, my wife said, "If these doctors do not listen to me, Charles, add the food."
That's right.
And I knew how to do that very well. And she said, "I want you to make sure that you advocate for me." Knowing my wife and how much I love her, I was committed to doing just that. If a doctor looked at her strange, I was ready to add the food. They told her the wrong information, I was ready to add the food. You were not going to treat my wife like she's inadequate. And I was committed to doing that. So I've been adding the food ever since. So that's why I'm committed to it.
Thank you. Thank you. Add the food. That's the strategy.
I would say two parts. One is that just growing up, I saw the impact of maternal mental health and health in general impact so many families, including my own. So even growing up, thinking about what I wanted to get into for my career, it led me to getting into perinatal health. And then when my daughter was born, I'm in the hospital, I work in perinatal health, I know all the doctors, and thinking that, well, I've seen so much happen to different families, I can prevent this. And even her mom on the table was very close to death at a moment. And seeing that even despite all these resources, all these connections, the implications is still hits all families and Black families. So this really has made me more motivated to actually engage in this work.
So it's not even just having the knowledge or the resources. It is irrespective. It's something we have to deal with. Dr. McKeever?
Well, I want to start by just saying thank you so much to the Congressional Black Congress for doing this conversation today. Because a lot of times the fathers are left out of these discussions, to be honest. And I actually was talking to someone last night who has a lactation nonprofit. And I said, you know, how do you involve fathers in this work? And she said, you know, we don't, we're trying. And I said, tomorrow, Congressional Black Congress, the Congressional Black Caucus Foundation is having a conversation on the role of fathers. So I'm honored to be the mother on the panel about fathers, but also, you know, this is personal for me. I am a mom, I'm a wife, I'm a sister, I'm a daughter. And I always, you know, I have enough degrees to make alphabet soup, but when I was in the hospital about to deliver my daughter, I would have died without my husband, because with all of my medical education, I nearly lost my life. And, you know, so as someone who is a physician, who's a public health advocate, we are a part of the solution as advocates and as leaders, but it's because oftentimes we are also a part of the story and the journey of the populations we're trying to impact. And so I'm really grateful that we're having this conversation today, and, you know, I look forward to hearing about, as you said, our journey and our solutions. Thank you.
Yeah, so I really want to just take a moment and just echo Dr. McKeever's sentiments of gratitude, right? Gratitude to all of you all who are here for this important conversation. Gratitude to all of you all. Y'all doctors, I'm the only one who doesn't have the doctor, even though Jesse tried to give it to me, right? He tried to anoint me as honorary real quick. I appreciate it. That's why that's my sister. So, but I just want to express gratitude to all of you all who have chosen this work, because unlike all of you all who have chosen this work chose me. And so, some of you all are familiar with my story, and I won't bog you down going into this very substantive conversation, but I was fortunate enough to meet a woman that absolutely changed my life. And what I understand 8.5 years later is when I walked into that hospital on April 12th of 2016, what I expected to be the happiest day of my life, right? As a father that really, truly thought I did everything right. I never missed a prenatal visit. I read all the books. I held her hand through Lamon's class, right? And it wasn't enough to ensure that my wife walked out to raise her boys. And so as I look back and I think back about what is it that I could have done differently? And when we talk about turning the place out and acting a fool and all of these things that unfortunately as a society, that's as black men, that's all we're armed with, right? And so I'm so excited to be here with you all talking about not only what we can do to assure that brothers are able to show up as their full selves, empowered to demand the care that their wives and their partners deserve, right? But to ensure that every single family not only survives, because survival is not the benchmark, let's be clear, right? To ensure that every single family thrives before, during, and after the birthing process. So I'm grateful and I'm excited to be here today.
Amen, amen. So the maternal mortality rate for Black women in the United States far exceeds that of other ethnicities. We are disproportionately at risk. I am one of up to 80% of Black women affected by fibroids by age 50. And my maternal health journey included a near miss with my heart stopping on the operating table when I was delivering my daughter due to complications from the fibroid surgeries. Now, you know, when I think about it, I'm asking you, what part can Black fathers play in reducing the maternal mortality rate, actively supporting and engaging with their partners throughout the entire pregnancy journey from conception to postpartum? Now having the rear view sight and what you've learned along the way, what are the key things for you that you feel fathers have to be involved in? We're going to start with you, Charles, since you last spoke, and we'll go just down the road.
Yeah, I'm gonna start simply and I'm gonna zoom out, right? So the simple piece of advice that I share with every single father that I encounter, the best piece of advice I ever received as an expectant father was that everything that she feels, the baby feels. So it is your job fundamentally to make sure that she feels safe, protected, and happy at all times, as much as humanly possible. That's your job fundamentally. And in addition to that, it's important that we are informed about all of the options available to us. What is a midwifery birth? What is a doula birth? What is a hospitalized birth? And what are all of the advantage and the associated risk factors, right? How to ask questions, how to advocate for your rightful partner in the event that things are left. And so it's not only important to be engaged once she becomes pregnant, but even preconception. Right? Understanding one another's health history is vitally important, right? So that you can make informed decisions throughout the entire birth continuum. And then also, I have to say too, how important it is for us to really show up in that fourth trimester, right? Understanding, being the first ones on the front lines to understand, postpartum distress, right? If we have severe swelling, if we have these headaches, if we have these signs that can be signs of things that are very critical, but then also, very importantly, being in tune with her mental and emotional health.
Absolutely.
And recognizing and understanding the symptoms associated with postpartum. That would be, that's a mouthful, but those are some things I would say that others really need to do.
I love what you said about the preconception, because many people don't know the research shows that actually the health of the male actually affects the health of the baby. In a very critical way. It's led to miscarriages, and this is everything from diet, so there's a major role right there, right? Dr. McKeever?
So when I think about that question, and one, I'll just add on, you've said a lot of things that I think would be important to share as well. The theme of this conference is about using our voices, and that's something that I really appreciate about what happens during this time of year. And it's not just using your voice in the hospital room, so there's that part of it, okay? But an advocate is, the other synonym for advocate is champion. And so you're a champion not just for that person at the bedside in your home, but it's using your voice to advocate for them in other places that impacts what they experience when they walk into the hospital. So, for example, a lot of people sign up to become advocates for different organizations that have meaning to them. It's important that you use your voice because policy dictates practice. And the practice that happens in the healthcare system, if your voice is not present, they don't know your experience. Your elected officials, they're here to represent your need. Does your member of Congress know, what this means to you? Being a champion and an advocate for the people that you care about is not just for the person that is carrying the child, but for your sisters, your mothers, your aunts, all of those that you care about in this space. And so that's one of the things that I think is important to pair with, our medical experience when we are faced with our mortality in this way, but using our voice as an advocate. So fathers are tremendous champions, and I love how, as a part of the description for this session, it talked about the stereotype that fathers are not active, that Black fathers are not active, that it is a stereotype that people have bought into. And so knowing that you have a voice and you can bring about action is equally important in this conversation. It's just wanting to bring that to light.
That's true, and we reject that fake news because the CDC's research showed the opposite, right? So that's some fake news. Black fathers are actually the most active when it came to, in comparison to other ethnicities. That's not something that you see or think based on what the stereotypes are in the media, right? Again, whose agenda is being promulgated? There's a story, there's a narrative that is being actually intentionally put before us, but it's not true. All right, Dr. Fisher.
Well, I appreciate these comments. I would add to this is that the mother's experience, becoming a mom, is such an isolated experience. So that for Black women, are already dealing with a lot of stress prior to becoming pregnant. And then when they become pregnant, they're already at risk for these different health outcomes. And what we do is, in the medical field, we fail them by saying, okay, you need to go do this at home, you need to change your diet, you need to take care of your mental health, do all this, take this medicine, and do it by yourself. So the father the role is to make it not isolated, so that she has a partner through this experience, who, as mentioned, can be an advocate throughout the whole experience. And And also they need training. Like fathers, they're not clinicians, they're not doctors, they don't understand, the health, they don't understand the health outcomes, but they can be trained on that to know what to look for. The mom doesn't always know what she's going through. She's just trying to get through the day to day, but you might notice something's a little bit different, something's wrong. At least ask her to talk to her doctor, or with her permission, even reach out to the doctor. This is something that makes it that they're a pair, really a unit, and there's a lot of research that shows father early engagement leads to long-term engagement. The father getting involved during preconception and prenatally means he's actually going to be way more involved postpartum and beyond. And so this is a critical period for them as a team to actually create that team versus it feeling like they're in bubbles, which society, and we'll talk probably later about policies, make it that they're separated. Without parental leave, one's at home, one's going back to work, they can't support each other. And there's different ways in which our systems really create a divide in the Black family.
Love that. Isn't the buddy system what we were taught as kids, right? It's like you go in a pair, you do this together so that you're not isolated. That's so important, Dr. Daniels.
Yes, I want to bring to light one of the stories of the amazing man I had the privilege of serving, who's a father. And, he came into our office with severe issues, with substance use. But if you don't ask him, you won't know why he was experiencing those issues. So one day he was at a party with his partner who was 7 months pregnant with his daughter. And he was drinking a lot. And when they left the party, the wife said, "Please let me drive." He said, "No, honey, I don't want you to drive because you're pregnant." Long story short, when he woke up from a coma, his daughter and his wife were already buried. He missed the funeral. And he will always have imprinted on his mind the day that he decided to drive when he left that party. Now, I share that to say is that when men enter the pregnancy with their partners, they're also entering with baggage that they may have dealt with, that they have not dealt with. And I told my wife, I said, "Babe, you're physically pregnant." And I said this at 7 months, when she was 7 months pregnant, and I almost got slapped. But I said, "Babe, you're physically pregnant, but I'm emotionally pregnant." Right? Which means that while my wife is carrying my child and dealing with the emotional upheaval of my stress, I'm also dealing with my own stuff. And if I don't get the therapy and get that checked, I would end up making the pregnancy even more difficult for her than it already is. So my first insight for men, we need to go to therapy. We need to get the necessary help to be able to be present. You can't act the fool correctly if you are bombarded by your trauma. So that's the first thing. So in order for me to act the fool appropriately, I need to get the help. Secondly, as a man, I need to make sure I have my care team in place. My therapist is a part of my care team. My primary care provider is a part of my care team. And also a friend that will listen and not try to give me unsolicited advice. Again, so get therapy. Get you a care team. And why is your primary care physician important? Because issues like thyroid-related issues that contribute to mood-altering behavior, pre-diabetes, right, depression. You want to make sure that you can eliminate and be on top of anything that can interfere with you being fully present with your partner throughout this pregnancy. Secondly, just to go and chime in on what some of my other fellow colleagues said, is that you need to be educated about the local and state policies in your area that impact the mothers of your children and even you. In the state of Massachusetts, there was a groundbreaking bill that was just passed where now doula services and midwifery service can be billed for insurance and you can get reimbursed for that, right? So families that can't really afford their care can use their statewide health insurance to get the necessary services during the pregnancy process. Also, more birthing centers, right? For families that may not feel comfortable with going to the hospital and having a pregnancy. So we need more comprehensive bills like that, but we also make sure that we're educated about those bills. But again, you can't do nothing for anyone else if you are not fully healthy yourself. We have a saying that follows up there. You can't parent anybody until you're able to parent yourself. And similarly, you can't be present for your partner if you're not able to be present for yourself. So bro, get therapy, get help. That's my insight.
I love it, I love it. And actually that went right into our next question, which, spoke about the untrue stereotype and, what challenges do men face in advocating for women, specifically what men should do to help with advocate for maternal health with respect to mental health. Is there anything else that anyone else wants to share around the mental health piece that Dr. Daniels might not have shared?
Well, I'll throw in there is that we also are doing a disservice to fathers around understanding mental health for them. So, for example, like many states are starting to move towards screening. We don't have a screen though for fathers, so we don't actually know in that family unit if the mother's depressed and gets better, gets the treatment she needs. If he's still depressed, she's still at risk, and the child.
Right.
So therefore, we need to have screening that applies to both mothers and fathers. The other part is we use traditional measures of depression. And what we know is that doesn't actually understand how do men experience depression. So men are not likely to say, oh, I feel depressed, or I feel sad, or cry. Men actually do something called masculine depression. They display externalizing symptoms, as in drinking, or hypersexuality, or aggression. Therefore, they don't, on the screener, they might seem fine, but in actuality, they are still suffering from depression. There was a recent study within JAMA Psychiatry that showed once you add in masculine depression, that 2-to-1 ratio of depression goes completely away. Which means in the perinatal field, what we're missing is that fathers might actually have similar levels of depression throughout the perinatal period, putting the family at risk and himself.
Mood disorder.
Because we're not actually understanding it from their personal experience.
Wow, I love that. Charles, I'd like you to actually address a different piece of this question, which is, what challenges do you face advocating for a woman's issue?
Yeah, so I think that that's important. And so on this journey, I've learned a lot, but I think as men, it's so important for us to show up and practice responsible allyship, right? Understanding that oftentimes as Black men, we don't think of ourselves as having a certain level of privilege, right? But as men, when we show up advocating for things that have been labeled as women's issues, the reality of the situation is these issues are not women's health issues. These are human issues, right? These are challenges that affect everybody. Because I say all the time, either there's two types of people, either you are a mom or you got one. It's just that simple, right? It's just that simple. And so I think showing up and understanding how to listen first, right? And understand that we are here in a supportive capacity. We are here to be of support. We are here to lend our voices. But just like any other fight, oftentimes things are heard and received differently from people who are quote unquote outside of it. We are working and we've developed tools on how to train fathers and men to advocate, to show up more informed and empowered. But at the same time, we cannot have a substantive conversation if we do not address institutional racism within the healthcare system, right? Because it doesn't matter how many books this brother read, how in tune with his own emotional intelligence he is, if we are sending them into the lion's den in systems that are grounded and rooted in racism, and there is not a move and a call to hold providers and healthcare systems accountable for the quality of care that they are disseminating to their patients.
Dr. Lakeitha, first of all, let's just, I'd like you to just kind of piggyback on that and the work you've done around social determinants of health, which are largely driven by the racism and the inequities in the system.
You know what, I'll say thank you for sort of calling it out, because that's what's missing, or what had been missing for a very long time in the medical space, where people would not say the word racism in the healthcare setting. Despite all of the data that we've seen over the years that are linked to racism in healthcare. So what I will say is right now, I'm very hopeful of where we are as a healthcare community. Because in the last several years, we have begun down a path of really starting to dig deep into the systemic barriers in the healthcare system. So, mentioned earlier, I was previously the director of the Office of Minority Health at CMS, and CMS helps to regulate the healthcare system, and it works across all these different streams of work that happens related to our care. And as a part of the Biden administration's efforts, every federal agency was tasked with looking at their policies through a lens of equity. And so from the healthcare agency to the research agency to the Centers for Disease and Control, like all of these different agencies, from labor, education, we were as a collective tasked to think about what we do and how are we able to remove barriers. And a part of that are the systemic barriers in healthcare. And so right now, a lot of that work is being implemented and driven in our healthcare system. So I am the Chief Health Equity Officer for AHIP. It is the trade association for the health insurance industry, so we provide services and care for millions of Americans. And so coming from that seat in the public system, so Medicare, Medicaid, marketplace, and now coming here to the private sector to really take the time to walk alongside our leaders who are making these critical choices and decisions, looking at how do we remove these barriers so that everyone has access to the care that they need. That's the journey that we are on as a healthcare system. And so I'm hopeful because 20 years ago when I stepped into a room, social determinants of health, I would get blank stares.
Yeah.
People had no idea what I was talking about.
Yeah.
Although most of the things that you're seeing that come through the hospital setting are driven by factors outside of that. So
For those who don't know, the social determinants of health are education, food insecurity. Can you just dig into that a little bit just to clarify?
Sure. So when we think about the social determinants of health, we sometimes will say is related to where we live, grow, worship, learn, right? So it's those things that influence our health that are social factors. So for example, if you live in a community, you were talking about someone sent home with all these instructions and things to do. When I worked in the diabetes space, very common to tell a person with diabetes, you get your insulin, you take it home, keep it in the refrigerator, etc. Well, people weren't asking, do you have a refrigerator?
Wow. Wow.
And so that person comes back 60 days later, 30, maybe even sooner because of what's happening in their home. And the question is, well, why didn't you take your medicine, right? Or what didn't you do that led you coming back here? And so it could be something as simple as they didn't have a refrigerator. Mm-hmm. Or if you tell them to work 30 minutes, if you live in certain communities, you can't even walk down to the end of your block safely.
Sure.
So social determinants of health are those factors that influence our health. So we have come a long way from the short 20 years that I've been doing this work. We're in a historic pivotal moment right now because this conversation has been expanded due to the policies, the advocacy work that has pushed the policies that are causing us to start to implement these things. And so we're at a pivotal point because bias in medicine is real. And you've seen probably books and stories and articles about all of the things that are related to that. So this is why this conversation is so important.
Thank you. As a society, we're getting better at acknowledging postpartum depression and the mental health of pregnant people, but we do not always talk about becoming a father and how that can impact mental health. Dr. Fisher, what can you tell us about the psychological impacts of fatherhood?
Well, I think it's important to highlight fathers, especially in this generation, are at a different phase. They don't have a blueprint on how to be a father. So they're coming from thinking about their own experiences and seeing, well, maybe I don't want to do what I experienced and grew up with. I want to do something different, but I don't really have a blueprint on how to do it. And this is difficult because that's their identity, especially as mentioned before about being like masculinity. What does it mean to be a man, but also be sensitive, to be involved in my family, to have equity in my home? This is something that is a lot for them to try to mentally adjust to. In addition, they're dealing with a lot more stress, as mentioned earlier too. Like I've applied for grants, got feedback sometimes like, well, Black fathers not involved. I'm like, there's little science that says Black fathers are the most involved.
Yeah.
When they walk to that doctor's room, they walk into any family-related thing, people look at them like, are you seeing, I got comments like that, with your kid, are you involved? And it's like, we don't actually give the respect of what we're doing.
Yeah.
And we're against that. And then when we come home, just in our society, not the particular person you're partnering with, but just in our society, fathers are ready, I use the term that another father's like euphemism for primary parent, secondary parent. We don't actually allow them to choose for themselves. What do you want for your roles in your family? So fathers are dealing with all of this, and then in addition to that, on top of it, not knowing how to deal with their mental health. Because in our community, for moms and dads, being strong means being silent, absorbing, not showing sensitivity, and especially for fathers, they want to support their partner. They want to make sure she's okay, so they don't want to complain at all. Not realizing that it still seeps out on how they engage with their partner and how they engage with the child.
Each of you, if you have anything to share specifically with what your experience is, how have you helped or yourself even deal with the mental health, implications of fatherhood? You want to start off?
I think that,
my fatherhood journey is not what I saw for my life, but it truly is, it's beautiful. I kind of describe my journey of fatherhood as a single dad, as my beautiful chaos. And to be honest, to be completely honest, my kids saved my life, right? Like, true story. I think that I enjoy every moment of it, but I think that I'm so grateful for what both of these brothers brought up about the care team, about being comprehensive, about being really doing a deep dive and addressing your own trauma, right? And so in the first part of this journey, for me, I really was doing the machismo thing, pushing through like therapy, you know, like I just wasn't, but I got to a point where trying to balance everything, I hit a wall, right? And I was like, I have to do something. And so being diligent about it, making sure that I'm, you know, I still haven't got my mind around this whole self-care thing, right? I think I have my own version of self-care, right? Right. But self-care for me is, you know, I think self-care has its own meaning for everybody. But I think that for me, just being deliberate about understanding my trauma, understanding generational things, understanding the things that I still carry forward from the loss of my wife, and then also making sure that I'm in tune with my sons, where they are and how they're navigating their world as they get older and more mature with the absence of their mother.
No, it's so true. You know, and kudos to you because you had it all at one time, right? So you found yourself in a crucible, and yet created such beauty out of it.
Thank you.
So thank you.
Thank you.
Dr. Kira? Oh, do you want to jump in?
Yeah, I did want to jump in.
Yeah, go ahead. Jump in.
Yeah, I think for me, and I just want to kind of touch on this, and this is a little bit personal. So we've been fundraising for fatherhood-related work for a long time and trying to bring the voice of fathers to the table. But one thing that we receive as feedback is that, you know, Charles, when you talk about fathers, that means you don't care about mothers, right?
Exactly.
So when you talk about fathers that are absent, that are trying to re-engage in their kids' lives, you're just, you know, ignoring fathers that are present, right? Because as Black fathers, we're present. And as a present Black father myself, who grew up in a single mother household with an amazing wife who was a Haitian immigrant, I understand both sides. Right? Understand both sides of the narrative completely and thoroughly. But when I talk about fathers that are absent, that are fighting to get back in their kids' lives, that's not me saying that me as a present father isn't present for my wife or my children. No. I'm saying, hey, you know, we can't forget about brothers like Tom, right, who was labeled a sex pedophile and missed his child's pregnancy, as well as wasn't able to be in his kid's life, who spent 2 years in foster care. Come to find out that the family admitted that they lied on him. So he missed 2 years of his child's life of pregnancy and always wanted to be engaged in his kid's life. So for me, I'm a huge fan of both narratives coexist.
Two things can be true at the same time.
One, it doesn't mean that I'm not present, and it also doesn't mean that this father fighting to be engaged in his kid's life doesn't care about moms. Both can coexist and both are equally important. And it ties into the issue with, not necessarily the issue, but the journey of being a man throughout the pregnancy. But if you can understand both dads' story, you can make sure that all dads can be present and available and advocates for their mothers. Not just one group of dads, like we who have the resources, who have what you call success, and could actually be there with their wives every step of the way. Don't forget about the dads in the shelter who have a baby on them. Don't forget about the dads with trauma, right, who need help with re-engaging in their kids' lives. Both stories coexist. And that's what we do to fathers up.
Excellent. And there's generational impact with those fathers not having the connection with their children.
Absolutely.
By not creating that bridge and not supporting them and not empowering them to reconnect with their children, you're still creating another generation of trauma, right? So the best scenario is for everyone involved, especially the children as well, is for their fathers to be whole and for them to have connection with them. So thank you so much for reading that. Dr. McKeever.
Thank you all so much. This is a very powerful discussion. So what I would offer is, you know, I think what I'm excited about being a part of AHIP is we are payers in the healthcare system. So, you know, we represent the companies that are providing access to mental health services. And that has been a journey for the healthcare system. And so we are now at a point where there is, record levels of opportunity for access, but we still have more work to do because we have a shortage of providers. So, that has been a part of this discussion in our space of, we have health plans that will pay for access and to mental health providers. And we're also pushing the rock up the hill of the lack of, there's a shortage in parts of the country for where people can access this type of care. And so we still have a journey ahead to ensure people have all of the services and tools that they need. But the conversation that you're hearing today is the why we continue to look for solutions with policymakers and others in this space to help us increase that access, because these conversations, these life experiences matter, and having that full care team as you're on this journey is critically important.
And it's part of the social determinants of health, right? Because if I have access to that care, we always say that what the mind cannot contain, it throws off on the body, right? So understand that physical health is the manifestation, physical illness is the manifestation of our brokenness inside, right? So if we don't have access to these kinds of support and service, it's going to show up physically in health, whether it's a heart attack, whether it's insulin resistance because of the inflammation that your body's been experiencing, it's going to show up. So holistically, we have to look at that. Okay, got it on time. Helping Black fathers advocate for Black maternal health is only one aspect of the Black maternal health issue. Other aspects are more structural in nature, including the healthcare system and healthcare policy. And we touched on that some, but I want to specifically zero in, and I want whoever feels like they have something specifically they want to share. What changes would you like to see implemented in the healthcare system to reduce Black maternal mortality? I'm going to start with you, Charles.
Oh boy. All right. So I'm going to be brief because I want to get to everybody else. But let me cut to the chase, right? There's a lot of amazing work being done in policy, but let me get down to it, right? If we want to close this gap and reduce the number of maternal deaths and reduce maternal morbidity quickly, while we're working on these issues around Black and white, we've got to make it about green. And what I mean by that is that if we are going to make an impact quickly, we need to have a fundamental standard of dignified care for mothers across the board. And performance in meeting that level of supplying dignified care is tied to payment and reimbursement.
Thank you.
If we want to fix this quickly, we have to make it about green, holding providers accountable, right? That's how we get this done. And so that's one of the big things that I'm pushing for is a counter providability, social accountability measures for providers to demand that they meet a standard, right? Because when it's tied to green, that's how we'll do this quickly. And I'll share something that some of you all may not know. One of the things that happened as a result of my wife's death is we actually had two nurses at Cedars-Sinai who were both whistleblowers that came forward. Not only did they speak to the failures in care and systemic failures, but they spoke to the role that my wife's race played in the care that she received. That then became the catalyst for HHS. That's where I'm going with this, y'all. That became the catalyst for HHS, the Department of Health and Human Services, for those of you all who are not familiar, who is the branch of the federal government that provides funding for hospitals to launch a civil rights investigation to Cedars-Sinai. So, what my hope is that when this investigation is concluded and they're able to establish a pattern of systemic racism at this hospital, that this hospital's federal funding will be in jeopardy. Which will then send a loud, definitive message to hospitals and care providers across the country that if you are not being aggressive and deliberate about dismantling systemic racism within your healthcare system, then you will be held accountable and your funding will be in jeopardy.
That's it.
That's how we fix this, along with all the other work that's going on.
Thank you. We got time here, so I'm gonna say.
Sorry, y'all.
One quick thing, each person, please, and so we can try to get to the last two questions that you feel needs to change.
So what I'll just offer is we have to keep going. Because what he's talking about, as I said, when I was at CMS, they were starting to really unpack and pull these things, but because of some of the policy things that are happening, states have expanded care for pregnant women at postpartum, so longer coverage. There's a designation for hospitals for maternal care now that CMS is doing. And so these solutions are happening because we have policy levers in place that are pushing the system forward.
Yeah.
We can't rely on individuals to change. We have to change the system so that they will do what they're supposed to do. So we have to keep going.
Keep going, because it's not going to change right away.
Although they're going on with Charles said, I think that's very important because for those who are in the OB/GYN office and in medicine in general, is buildings, RVUs, you have to keep a number of patients coming in and out, and therefore we need to incentivize for people to actually take time with their patient versus rushing through those appointments. In addition, though, we need, for my world, is screening. We need to make sure that screening is nationwide for perinatal depression. We know that for the OB/GYN outcomes, the highest risk of death is mental health. That means that we have to take mental health more seriously versus thinking pre-diabetes, diabetes, or other issues. Mental health is a core component, so therefore we need policies that actually support the screening of that. And then finally, parental leave. That for the father to be involved, he needs to be able to be home with the mom.
Paid leave for all, absolutely.
I think in addition to all those great things, I think when we look at these maternal health task force and these maternal health commissions, we need to make sure that there's fathers that's a part of those, right? Men that want to be allies for the mothers. Typically, when I'm a part of these commissions and these task force, I'm one of 3 men. And I know there's many men in the country that want to advocate for mothers. Right now, we see a silo between maternal health work and paternal health work. We're family. We need to work together, right? So I need to bridge that gap.
That's
a part of it.
collaboration.
Absolutely.
Every day.
Yeah.
Okay, so as we wrap up this conversation, one of the ways I turn my pain into power is teaching patients and providers lessons from my maternal health journey that I believe can revolutionize patient care and really improve the outcomes. So I call them my 3 laws for exceptional patient care. So I'm going to share mine, and I want you each to share 1 to add to the list, okay? So my 3 are, I say, listen to your BAE, your body, your advocates, and your experts, okay? Now, from the patient side, this is my BAE, and from the provider side is listen to your patient's BAE, okay? So BAE is B for body. Pain is a vital sign that should always be responded to with urgency. So pain is a vital sign. A is for advocates. Medical bias is real. Everyone needs and deserves an advocate. How would healthcare change if everyone had an advocate required? E is for experts. There are always 2 experts in the room when you go into an exam room. There's the physician who is the expert in their field, and there is you who are the expert on yourself.
Absolutely.
You never stay with a physician that will diminish your expertise.
Absolutely.
What would you add as a game changer for a solution that you believe will change the health outcomes? Let's start with you, Dr. Daniel.
Wow. So I would say, don't assume your provider knows. Because often they may not know, so you got to teach them. So I'm going to add that, don't assume.
Excellent.
I would throw in their entitlement, that you should feel entitled to your health and to your life, that you don't feel ashamed to interrupt your doctor, you don't have to be hidden. You have the right to actually advocate for yourself and not feel like you deserve less than anyone else who else in that room.
Excellent, excellent. So walk in knowing, right, that you're an expert. Walk in.
No matter who you are, you deserve excellent care. It doesn't matter your race, your ethnicity, your gender, your socioeconomic status, your gender identity. You deserve excellent care no matter where you receive care, and don't leave that facility until someone listens.
And I'll just be a little more hyper-focused on, for men, non-birthing partners, in specificity, right? There's a lot of emphasis, a lot of attention focused on the mother and the baby, as it should be. Understand that you are a vital part of that trilogy. Understand that, and do not let anybody dismiss, diminish your role in making sure that you have a healthy, vibrant birthing experience. And lastly, I want people to go into these experiences expecting a beautiful birthing experience and not be ruled and dictated by fear and trauma.
No, I love that, because so one of my colleagues recently just gave birth and she was so scared because there's always another story, right? And it's really important for us to understand that just like there are horror stories, there are also hero stories,
Yeah.
right? And that, if we go in and we have to go in as our advocates and we are a team, because all the things we're pulling together, everything we talked about, we are a team. The birthing experience is not just for the mother, it's the mother and the father, right? And that we are not assuming that they know something, that we are making sure that we're getting the screenings, all the things we're talking about. That guess what? Beautiful health outcomes are possible. They are, and they are our birthright,
Yep.
right? They are our inheritance, that we deserve them. So I just want to thank each and every one of you because this was, we had questions we didn't get to because this was such a profound conversation and each of you brought something very special to it. And again, I just want to thank the Congressional Black Caucus, thank the sponsors that felt this was such a valuable conversation to have. And I want to thank each of you because you could have been in any other room today, but you chose to spend this time with us. And that means, guess what? You are now the spark that's going to take this information and you're going to share it forward, right? So I'm going to ask each of you to really ponder and think about what we've shared today and to share it with the men in your life. Share it with the women in your life because what we're doing is reshaping a new narrative. Did you know that the stereotype was wrong? Share that. Did you know that really that we have more power than we realize? These are things that together, by taking this, everything that we've learned, we can turn around and make a ripple effect and impact so many other lives. So thank you.